All right, welcome to the Daily Briefing for Thursday, June the 4th. Our time, Monday through Friday, to visit with folks at the forefront of Cordova's response to the pandemic, and particularly when things change, like the out-of-state traveler mandate, which is undergoing some changes officially beginning with the travel day on the 6th of June. And we are going to visit with no less than one of our medical experts. Dr. Hannah Sanders is our guest for this one. These programs air on the radio in the 1 p.m., 5 p.m., and 8 p.m. hours Monday through Friday, and then are uploaded into the archive at youtube.com/Cordova TV. So if you ever want to hear one again, if you're not available during our radio time slots or want to share the information with someone outside, in this case perhaps someone that you know is going to be traveling to Cordova, then you're welcome to pass that link along. So let's talk to Dr. Sanders here on the Daily Briefing on KLAM and KCDB. Dr. Sanders, a pleasure to have you with us. Obviously a critical member of the incident management team. The big news regarding the state's COVID-19 response of late has been these modifications to the travel mandate. We heard the press conference last night. Actually, we aired it this morning on our talk show for anybody that wants to hear that whole thing. But what always seems to come to the forefront of a lot of minds, anyway, in Cordova is what do our local folks think? So, as you maybe if you want to highlight some of the changes that are coming starting June 6th, and then Cordova's response.
Great, yeah. So I think the key thing to review is, one, what hasn't changed, and that's all travelers still have to complete the same declaration form that they previously had to complete and submit it on arrival to Alaska. The other thing that hasn't changed is any employees from essential industry, so the fish processing, the hospital, or any other businesses that had to submit work plans to the state for their employees traveling, have to continue to follow those work plans as submitted to the state. So travel for all of the essential employee folks has not changed, and their quarantine testing strategies that they have, that isn't changing.
Okay,
really,
and so that kind of covers, for example, the one that gets talked about the most is somebody coming in to, say, work at a processor. If you're a Trident employee, the changes to Mandate 10 don't supersede what Trident's work plan is. And I don't mean to single out any one, but that would apply for any of the processors. Like you said, the hospital workers, any of the essential workers who are able to be designated that way because they have a plan. None of that changes.
Absolutely. So singling out Trident, I actually got to stop by there this morning and see them and see their medical facility, and they have an excellent plan. We're working together, and their people on the ground here would not want to change their safety plan. They are very committed to keeping their employees safe this summer and keep their fish processing going so that they can proceed and have a successful summer.
Okay. So getting back, so with those things that don't change emphasized, what does change, and what's your sort of top-down view of the city's response or perspective? I mean, from the standpoint of the city medical experts.
Certainly. So the changes are that people can travel to Alaska from out of state if they've had a negative test within 72 hours of their travel. When they arrive, they are not required by the state to have that 14-day quarantine. The state states that if they arrive and haven't had a negative test, they have to get a negative test on arrival and then self-quarantine until they have the results.
Or they have to voluntarily submit to this. If they don't like the idea of having to be tested, they can opt for the 14-day. I can't imagine anybody would want to choose that, but that is that. So they do have a choice, right?
They have that third option, and with the second testing option, if they arrive and have a result, new arrivals are also given a voucher, which in Cordova we won't need a voucher, but for other places they're given a voucher so that they can go and get a second test at 7 days of their quarantine after their arrival, whether they're quarantining or not. So we're having a very aggressive testing strategy here in Alaska. Here in Cordova, we have had an aggressive testing strategy since we got the capabilities to test. So this doesn't impact us significantly, aside from making sure that we get the education out to our new arrivals so that they know how to come and get tested, where to get tested, and then making sure that they complete that testing.
So when our ambassadors, say, are greeting people that are coming in, presumably they'll be armed with this knowledge, do you know?
Yes, so we're going to be working with the ambassadors. And actually, the city and our city manager, Helen, have been really instrumental in helping get our ambassadors educated. And then we're working to see if we can get a nurse that's working alongside the ambassadors to help collect the COVID swab out in the community at either the docks as boats are coming in or at the airport. So we've had an aggressive testing strategy. We're brainstorming new ideas of how we can become a little more aggressive with our testing, just to make sure that if we do have a case in Cordova, we isolate it early before other community members are exposed.
So you feel like our medical capacity, our testing capacity, our ability to respond quickly, you feel like that's all still in good shape in light of some of these coming changes?
I do. I feel like we're in really good shape, and continually throughout this whole process, I've heard from other communities that have asked how we've done this, how we've created this testing availability, and it really is just this cooperation between our tribal partners in the city and the hospital that has helped us stand out in our ability to respond. So I'm still comfortable with where we're at and feel very reassured with our testing capacity.
Good. Okay. Well, I appreciate your overview on that. We'll continue to see how the city's official response to this evolves. I heard talk of a special meeting on the 10th. Does that stick in your head too?
I am not certain.
Yeah, I'll go look it up. We won't put that one on you. Anyway, so that's a really good overview. Again, it's good to hear from you as our medical person. A question that I put to you that got lost, unfortunately, when that great show we did Tuesday evaporated into digital death, whatever. Had to do with the opening of the playgrounds. And there have been some, obviously there are printed recommendations that came out with that in the flyer. People seem to be pretty excited about that. I had wondered, did you have any extra advice or any thoughts on how to do that safely, for the families and the caregivers?
So I think if other families are like my family, kids are very excited to get out to parks, and we just need to make sure that we're talking to our children and educating them about this idea of social distancing and keeping space when they're playing. I certainly have talked to my daughter about how to not share toys and come up with other ideas and strategies for playing chase instead of, say, tag, and not getting into people's personal space or personal bubble. So we want parents to be educating their children on social distancing without scaring them, but just helping them to understand that we are giving people a little bit extra personal space this year. Families also should plan on bringing their own hand sanitizer or wipes so that they can clean their children's hands and help keep those germs out from the playground. We always recommend that if kids are sick, coughing, runny nose, they stay home and don't go out to any public spaces, including the playground. One good thing about playgrounds is the sun, and in Alaska summers, we'll see, but get a lot of sunshine that helps to sterilize the playground equipment. So that is going to be on our side. The other thing we get in Alaska is a lot of rain, so that humidity helps those respiratory droplets be larger and heavier, and they drop out of the air quicker. So I feel reassured with the safety of the playground and kids playing outside. I think that it's going to be something that we can implement safely and not be increasing our risk by having kids outside.
Now, what about a situation where a family has somebody in the vulnerable category? Say an elderly person, diabetes has been identified, general respiratory problems, immune problems. We'll use grandma again. If grandma lives with the family and the kids go out to the park, we know the numbers don't suggest that kids really spread it to each other that much, but do families with vulnerable family members need to give this playground use some extra thought?
Families with vulnerable family members that are household contacts or going to be interacting within their bubble as a household contact absolutely need to be giving all of their contacts a little bit of extra thought, because we do want to bubble and protect those, or maybe the idea is more of a cocoon for those more fragile members of our community. We definitely do want people to be giving those extra thought. I think that those families, if they have children, can probably very safely play at the playground. The question is more can they safely play during times of high playground volume? So if they go to the playground and they're the only family there, I think that they should let their children play, make sure that they wash hands when they get home, and they'll be okay. The question is really, when there's other kids, are we going to always be able to keep kids out of each other's personal space so they're not potentially having the respirations where they're sharing air? And that's going to have to be every individual family's choice. But I would give a little extra thought into, if I saw a busy playground, I probably wouldn't want those families at the playground on those days. Sure.
And one other thing that occurs to me too, as you and I discussed, I think in the Fatally Destroyed program, how the science of this is constantly evolving. Or maybe that was when you and Dr. Rush and I were talking last Friday. But with the constantly evolving science, one thing that came out is the touch transmission, the being able to catch it from surfaces. What's the latest that you've heard on the chances of that, and to what extent do people need to remain concerned about catching it by touching a piece of playground equipment or a shelf at the store or that sort of thing?
I still think frequent hand washing is important, in making sure that when you're touching surfaces, you don't accidentally introduce something into one of your mucous membranes. So rubbing your eye or touching your mouth certainly increases those risks a little bit, but it doesn't look like the contact is a significant portion of transmission for COVID. It looks like it's primarily through respiratory droplets, which is part of the reason that the scientific community feels pretty strongly about masks. It does decrease those respiratory droplets. Contact at the playground, it's really thought to be a safe. We haven't seen any clusters other places in the United States that are coming from playgrounds, and I think that's a really important thing. Certainly, we did respond really early. I think playgrounds were one of the first things to get closed down. So as we reopen them, could I be coming back in 2 weeks and saying otherwise? Certainly with COVID, we've seen that we have had to change occasionally as we learn, but I don't anticipate the playgrounds being a dangerous spot.
Okay, well, that's certainly very encouraging, and particularly coming from you. And as far as how things change over time, I can't even predict 24 hours in advance that a daily briefing that I was absolutely certain was coming that day would successfully make it to the air. So I've given up on predicting anything certainly in this year, and maybe never again, ever. Dr. Sanders, thank you so much for joining us.
Thank you.
Dr. Hannah Sanders, a very important part, obviously, of our incident management team. Great to hear her voice today as we try to, in Cordova, I should say, unpack the particulars of the changes coming to Mandate 10. Now, if you want to read what the state has written up on that, you can go to the state website, obviously, covid19.alaska.gov. We also, this morning on our talk show, ran the audio from yesterday's press briefing with the governor and his staff, Dr. Zink, Commissioner Crum, and so on. and included the questions from the press in our playback of that. You can find that show if you would like to be able to listen to it if you missed it at youtube.com/Cordova TV, which is the same place that this program will go pretty much as soon as we're done airing it here. Robbie will get all of those uploaded. youtube.com/Cordova TV. Today's talk show, which was a more detailed look at the state's perspective on what's changing, and then this program with a local doctor's perspective. We should be back tomorrow with you at 1, 5, and 8 for the next daily briefing. Again, archived at youtube.com/Cordova TV. We hope you have a great day, and we'll get regular programming back underway on the Clam and the Eagle.